Hey guys, Dr. Testicle UroCoach. So in this video, I'm going to answer the question, what the heck are we feeling for when we do the testicular exam? Stay tuned. Hey guys, Dr. Testicle UroCoach. So we always get asked the question, what are you feeling for when you do the testicular exam? And I'm going to answer that today, but please first like, subscribe, comment. We want to hear what you guys want to hear us talk about, okay? And at the end, I'm going to give you my pearl of wisdom for something that you can do at home to make sure there's no significant serious abnormalities in the scrotum. So make sure you stay tuned for that. So the first thing we're trying to feel for is the size of the testicles, okay? So we have sort of a comparison in our head for what an average size testicle should be, because if you have small testicles, it can be a sign of infertility, it can be a sign of decreased sperm production, and it can be a sign of decreased testosterone production. So that's one of the first things that we're feeling for, okay? The next thing we're feeling for are the structures around the testicle, okay? So there are these cord-like structures that are above the testicle. It's called the spermatic cord that carries the blood vessels that go to the testicle and also carries the vas deferens, which is the structure that transmits sperm into the ejaculate. So we feel for these structures, and oftentimes we're feeling for something called a varicocele. What is a varicocele? A varicocele is a collection of veins on one or both sides of the testicle that can sometimes cause infertility, and sometimes it can cause pain on one or both sides. Now, varicoceles are more common on the left side than the right side, but we obviously feel for both sides. If we detect a varicocele on the right side, that can sometimes be a cause for concern, because if you detect a real big varicocele on the right side, it can sometimes signify that there is impaired or problematic drainage from the testicle back into the abdomen. So oftentimes we'll get a CT scan to make sure there's no abdominal mass if we detect a sizable right-sided varicocele, or sometimes any right-sided varicocele at all. So that's sort of the next thing that we're feeling for. Then we're feeling for fluid around the testicle, right? So if we feel fluid around the testicle, it could be a couple things. One, it could be a hydrocele, which is a collection of fluid around the testicle, or it could be a cyst of the epididymis. The epididymis is a structure that sits above the testicle, and we call those cysts spermatoceles. So we're feeling for those things. Now, you can oftentimes confirm those diagnoses that we make on a physical exam with an ultrasound of the scrotum to see if there's a hydrocele and or a spermatocele there. Now, hydroceles and spermatoceles in general are not considered dangerous to you, but the treatment for it is a surgery. If you don't like the way it looks or you don't like the way it feels, we can consider doing something like that. Then oftentimes we'll go back to the testicle and make sure the testicle feels completely normal. And this is sort of my pearl of wisdom for the thing that is really important that we do on the testicular exam that you should do at home to make sure that you don't feel anything significantly abnormal. So when we do the testicular exam, we are feeling for anything that is hard, right? Like a pea-like structure, a marble. And if we feel that in the testicle itself, that's a cause for concern. And certainly we get an ultrasound ASAP, and it gets concerning for testicular cancer. Now, this is important to know for you all for a couple reasons. First of all, testicular cancer tends to be a young man's disease. Now, not to say that older men or very young children can't get testicular cancer, but in general, the demographic or the individuals that tend to get testicular cancer are aged 16 to 34. So it's really important for young men to do testicular exams. Where's the best place to do a testicular exam at home? Usually the shower, right? Obviously, it's a private area. And also, the scrotum is hanging lower in the shower, so it's easier to do a testicular exam in that situation. So if you feel anything hard like in the testicle itself, then that's a cause for concern. So make sure to do the testicular exams at home. That gives you a primer for what we're trying to feel when we do testicular exams in the office, and gives you a tip for what you can do at home to sort of protect yourself. Thank you so much for listening. Please like, subscribe, comment. We want to hear what you guys want to hear us talk about. Thanks.